we will talk about the ischiorectal fossa. That is an important structure in the anal triangle. Basically, ischiorectal fossa is the space created between, or that is the space on each side of the anal canal. This is the rectum. Below the rectum, this is the anal canal. And on both the sides of rectum and anal canal, right and left ischiorectal fossa are situated, filled with the fat. So about its boundaries, anteriorly this ischiorectal fossa can extend up to the pubic symphysis, just behind the pubic symphysis. Otherwise, normally its anterior extent is up to this imaginary line. And when it extends behind this pubic symphysis, this extension is known as the anterior recess. Posterior extent is smaller than the anterior extent, as is limited by the sacrotuberous ligament. As we all know, this is the sacrotuberous ligament. Both these ischiorectal fossa are communicating behind the rectum and anal canal through a horseshoe-shaped recess. So it is having the anterior recess, posterior recess, and horseshoe-shaped recess, communicating with each other also. Now, clear-cut boundaries will be studied in the coronal section. Laterally, as we all know, above it is formed by the obturator internus muscle. This is obturator internus muscle, bridging the obturator foramen internally, and it is covered by the obturator fascia. And in the lower part, this is formed by the inner surface of the ischial tuberosities. Then coming towards its medial boundary, medially, this is the whole medial boundary. This is the lateral boundary. Medially, in the upper part, it is formed by the levator ani muscle covered by the anal fascia. This is the green colored anal fascia, and below by the sphincter ani externus muscle. So what is this? What is this sphincter ani externus? This sphincter ani externus muscle is a separate sphincter that lines this anal canal completely. External anal sphincter, this is a green colored external anal sphincter that lines this anal canal completely. And internal to that, this red colored structure is the internal anal sphincter. This is the internal anal sphincter, this is the external anal sphincter. Internal sphincter is formed by the condensation of the inner circular, this C for the circular muscle coat of the rectum. Okay, so internal sphincter is basically formed by the condensation of the inner circular layer of the rectum and anal canal, and it encircles the upper 3/4 portion of the anal canal. The lower 1/4 portion, this is the 1/4 portion of the anal canal, that is subcutaneous, and upper 3/4 portion of the anal canal. So upper 3/4 is surrounded by this internal sphincter, and external sphincter covers or surrounds whole of the anal canal. Now, after its lateral and medial boundaries, about its anterior and posterior extent. Anteriorly, it extends up to this imaginary line where an important muscle, that is transverse perineae superficialis muscle, is situated, stretching across the ischial tuberosity to the perineal body. These are the two important muscles in the superficial perineal pouch inserted on the perineal body. So anteriorly, the boundary is formed by the superficial transverse perineae muscle, and deeper to that, there is another muscle in the deep perineal pouch, that is deep transverse perineae muscle. Deep lying in the deep perineal pouch, superficial lying in the superficial perineal pouch, and the arrangement is just parallel to each other and in between the three layers of the perineum in the urogenital region. So that is all about the boundary in the front. Then posteriorly, the ischiorectal fossa is limited by the sacrotuberous ligaments. These are the sacrotuberous ligaments. Then medially, as we all know, we all have discussed, medially it is formed by the rectum and anal canal, lower part of the rectum and anal canal in its whole extent. So now about the facial arrangement over this region, that is around the ischiorectal fossa and perianal region, and about the pudendal canal, that is an important facial tunnel in the lateral pelvic wall, pudendal canal and its content. So first of all, about the facial arrangement over this region. As we all know that whole of the GIT is lined by the inner circular and outer longitudinal muscle coat. Inner circular is condensed below, forming the internal anal sphincter. This outer longitudinal coat, this purple colored coat, goes below and merges with the levator ani and pelvic fascia to form a conjoint fibroelastic septum. This is the conjoint fibroelastic septum. This conjoint fibroelastic septum divides into medial and lateral septa at the level of Hilton's line of the anal canal. This medial septa here gets attached medially to the mucosa of the anal canal and divides it into upper 3/4 and lower 1/4 part, and having a puckered appearance internally at the level of Hilton's line. Laterally, it is giving out another septum that is known as perianal fascia, dividing and this region into the ischiorectal fossa above and perianal region below. Then there is another fascia, that is the anal fascia, covering the external anal sphincter externally. Then it goes above and it covers the undersurface of the levator ani and it merges with the obturator fascia at the level of the apex of ischiorectal fossa. This is the anal fascia, green colored anal fascia, and this is the perianal fascia, limiting the ischiorectal fossa below or separating it from the perianal region. Then there is another fascia, that is the lunate fascia. This is the lunate fascia that arches over the ischiorectal fossa. Medially, it merges with the anal fascia at the level of the spectinate line and goes laterally, arches over the ischiorectal fossa and goes below and splits into two to enclose this pudendal canal. Here the apex of the lunate fascia, the space created is known as tegmentum. Okay. So here this pudendal canal that is formed along the lateral pelvic wall opposite the ischium bone. More clearer in this picture, the extension of this pudendal canal is from the lesser sciatic notch, midpoint of this lesser sciatic notch, towards the deep perineal pouch. Okay. This is the imaginary line dividing in perineum into the urogenital and anal regions, and at this line This is the location of the deep perineal pouch. So this canal extends from the lesser sciatic foramen up to the deep perineal pouch, and this pudendal canal is a interfacial space in the lateral wall of the pelvis related to the ischiorectal fossa, forming its lateral boundary. The contents of this pudendal canal are internal pudendal vessels and pudendal nerve. One of the branches of this pudendal nerve, that is inferior rectal nerve, crosses this ischiorectal fossa from lateral to medial side, and it pierces the external sphincter and supplies it. So the contents, when asked about the contents of this pudendal canal, you have to tell about the internal pudendal vessels, pudendal nerve, now about the contents of the ischiorectal fossa itself. Okay, as we all know that pudendal canal is forming the lateral wall of this ischiorectal fossa. So the main content of the ischiorectal fossa is the internal pudendal vessels and pudendal nerve within this pudendal canal. And here in this canal, this nerve divides into dorsal nerve of penis and perineal nerve. Dorsal nerve of penis goes towards the urogenital region, and perineal nerve goes towards this posterior part of the perineum. Okay. Then there are other contents also, such as posterior scrotal vessels and perineal branch of the fourth sacral nerve, that is coming from the sacral plexus, and posterior scrotal nerve, that is a branch of the perineal nerve itself. So these are the main contents of the ischiorectal fossa. Inferior rectal nerve crosses this fossa from lateral to medial side. Then there is a one more applied importance of this region is that the ischiorectal fat is predominantly very fibrous and it's poor in blood supply. So infection here is the space is very prone for the infections and tension created, and here the pus over here can burst into the perianal skin also. An abscess from one ischiorectal fossa can spread to the opposite ischiorectal fossa through this horseshoe shaped recess, because both the fossa communicate with each other posterior to the anal canal. So one infection from one fossa can spread to the another fossa also. One more hiatus that is discussed or asked over here, that is hiatus of Schwalbe. This hiatus of Schwalbe is basically a gap created here when the levator ani muscle fails to originate from this obturator fascia. Means at some places it is having deficient attachment to the obturator fascia. Basically, levator ani originates from the obturator fascia itself, but at some places it is having gaps. So these gaps are known as hiatus of Schwalbe, and the pelvic viscera can herniate through this hiatus of Schwalbe into the corresponding ischiorectal fossa itself. Thank you all for the patient listening.